Hi everyone, it's Natasha. Today we're talking about food. It's been quite a journey for us, and I'm sure for most people who have children who are autistic, it can continue to be a journey long after they are into their preteen years. For us, there was automatically some difficulties when it came to latching on when it came to nursing. He couldn't for 5.5 months. The doctors checked to see if he was tongue-tied. He wasn't. Everything seemed fine. However, now I understand that it was sensory processing, that he just couldn't necessarily latch on the way he needed to. And the sensation of the milk going to the back of his throat really made him gag and made it difficult for him to be able to nurse. Those muscles eventually grew stronger, and that is when he began to nurse from 5.5 months until he was 3.5. After that time, he began going to preschool. He was eating only pancakes and only Haitian rice that I would cook, and I would kind of blend veggies together. I would make the beans and pick all the beans out. I would mold it with my hands into a specific cone shape that he could pick up with his hands and put directly into his mouth, as well as some bananas. And that is the extent of what he ate during that time frame. He essentially skipped over stage foods entirely. I remember trying to introduce stage 1 and even stage 2 foods, and they made him just projectile vomit. The texture alone freaked him out so much that he just couldn't stomach it. So it's really difficult when it comes to texture. Maybe they like the taste of the food, but maybe the texture alone is the biggest factor. Around the time that he reached about 4 or 5 years old, he started experiencing food aversion. So a lot of the things that he used to love, suddenly he hated. He had finally eaten this food and we were so excited, so we bought loads of it. And then one day, suddenly, he just despised the food, and now it's just a ton of them sitting in the freezer. And that's how food aversion would work. He would go through months of loving this one particular thing and then absolutely hating it for a couple of months. Maybe he got tired of the taste. Maybe it just grew to be one of his dislikes, but it would happen abruptly, leaving you stranded and leaving them in situations where they might decide that they just don't want to eat at all. This would also be an issue if a manufacturer suddenly changed the recipe or was discontinued, and now you're frantically looking for this item that they would finally eat and it's nowhere to be found. At some points, I would be so desperate to get food into him that I would blend ground meat into pasta sauce with vegetables and try to sneak it into pastas or rice or whatever it is that he was willing to eat. And that was a great way to try to get something into him. Around 6 to 8 years old, he began to eat nuggets, but not really. He would peel the outer casing of it. He would lick the salt on fries, but he really genuinely wouldn't eat them. He also licked vinegar chips, and I think that was more or less maybe specific kinds of taste dealing with maybe some mineral deficiencies, because he really loved salt and really loved the taste of vinegar. Through therapy, he began to try new foods such as broccoli. At first, it was absolute tears and just hated it. And he would get to try some broccoli and then have a preferred item. And that's kind of how we introduced new veggies. Soon it became green beans and broccoli and collard greens and other things. And that was great. We continued to implement more and more greens as we went along and newer foods. This year, in his 4th grade year in homeschooling, we have decided to add in a lot of practical life skills, including cooking and chores and those kinds of things. The cooking has given him the opportunity to be a part of the cooking process of the food. So with him making the food from start to finish and helping in the preparation, he is more likely to try the new food. He's tried curry chicken and rice. This is the first time that he's eaten meat off of the bone. He's tried beef and other types of things, and that has been huge. One of the biggest things that has happened this year is that he has come to the conclusion that he doesn't like fast food nuggets, whereas before he would suggest it and then eat only the casing and then just leave the rest to waste. He's come to understand that he genuinely doesn't like it, and therefore he doesn't have to get it. He can choose items that he likes or just choose not to eat it at all. And that's been huge, because we have driven to fast food places only to have him just pick at it a tiny bit but not get any nutrition from anything. So around the age of 7, we had an incident where he had been sitting on a couch with us and he was given a piece of candy. I heard him suddenly inhale, and then his hands went around his throat and he began to frantically tap up my arm. And it took me a second to understand that what was happening was that he was choking. I tried to remember my training. I called for my husband to call 911. We're both frantic. I just sprang into action and began the Heimlich maneuver on him. I was nervous at whether I was using enough pressure or if I were using too much pressure, if I would break his ribs, if I was doing it right. And the whole time my mind is just kind of spinning, thinking this could very well be it. And that was terrifying. Eventually it got thrown out, and that's when I had just been in complete shock for days. I must have cried for days because it was so traumatic for us. So I definitely want to tell you and remind you to make sure that you are CPR and first aid trained. Get those certifications if you can. If not, go to YouTube or go to their websites and study the information so that you will be prepared should this happen to your child. Since then, I have had to do the Heimlich on him 3 times. We know that some of our kids will experience some issues with sensory, some issues with low muscle tones, and some issues with chewing and swallowing and feeding. So if you're having any of these issues, then maybe consult with your doctors and look into potentially feeding therapies or anything that will help you. But be trained so that you can do your part should you have to. So how do we as his family support him when it comes to fostering a healthy relationship with food? We try to teach him the difference between wants and needs. We'll go over specific items and discuss whether it is a want or a need, whether it is a sometimes food or often food. We'll go into the health benefits of food or the things that is detrimental to us, like too much sugar, or what that means for our teeth and the dentist, and where those kinds of food-related illnesses come from, so that he could have a better understanding of nutrition and caring for his body when we're not there to make decisions for him. That also leads us into discussing his allergies. It's important that he knows what his allergies are and what things could possibly happen should he try them, and that he has to learn to advocate for himself, that if mom and dad are not around, that if somebody offers him peanut butter or shellfish, that he declines and let them know that he is in fact allergic. And that information is also important so that he can advocate for himself should he be in a medical situation where he has to tell a nurse or a doctor. He needs to understand what could happen to his body, whether he would need an EpiPen, whether he could be hospitalized or be put in a potential medical emergency or shock. We also support him in ways of sneaking in vegetables and fruits where we can, with multivitamins, with soluble fibers that will help him stay regular. When he gets stressed, he tends to kind of hold everything in because that's something that he can control. The other way that we can support him is by giving him like beet juice and cranberry juice, along with probiotics to help his body's retain some antioxidants. I want to let you know that whether you blend things in, mash it in, or do whatever you can to get some nutrition into their bodies, go ahead and do it. Sometimes they just don't get adequate nutrition, and that's not entirely your fault. It's very difficult sometimes. I know some kids will only eat a specific thing that may not be healthy, but during times where they are just losing weight, it's important to just feed them maximum amounts of their preferred items, even if that item is junk. That's the advice that my doctor gave me, and that helped us through sometimes where he decided he just wouldn't eat. Feeling sick also could lead to them feeling like something is happening in their body. They just can't express it. So the first thing they might do is decide not to eat. So continue to feed them where you can. Whatever they want to eat, it's important that they get nutrition at all. If you haven't seen a feeding specialist yet, you could possibly look into that. The other thing is to remember to give yourself some grace during these periods, because they are in fact really difficult, and it's hard for people to listen and understand when you say that your child is literally not eating. You may get advice like, well, if they're hungry enough, they'll eat, and that's not the case with autistic children. Sometimes it could lead to more severe issues. So be sure to keep your documentation from doctors and therapists when it comes to feeding issues, so that you never find yourself in a situation in which someone could be suggesting that this is a malnutrition or neglect type of situation. If your child has stopped eating so severely that they may need a feeding tube, know that you're not at fault, and just work with your doctors and your team to ensure that your child gets whatever they need. Personally, my son has never dealt with pica, but I know through experience a few people who have. For those who don't know, pica is when people eat things that are not meant to be eaten, things that are not edible. So sometimes they could be due to a sensory thing, sometimes it could be due to a vitamin deficiency thing. But regardless of where the causes come from, talk to your support system and your professionals and your doctors to see if your team can come up with a plan to tackle that. It has been a long journey, but he has come such a long way. He is just starting to eat so many things that he never did before, things that we didn't imagine that he would eat. And there were times when I wasn't sure that this would happen anytime soon, but what a pleasant surprise it's been. He will still go through periods of maybe not eating or slowing down if something is happening in his body, changes happening, growth spurts, he may eat a little more, high stress, he may cut back. So just keep an eye on where those behaviors lie when it comes to feeding, because the relationship is all connected.